Medical world, few things are more controversial than medicinal cannabis. Some experts swear by it, others aren't as convinced.
Marijuana in every state in this country.
The House of Representatives is paving the way to decriminalize
marijuana is still illegal at the federal
Everybody
level.
should know there's a very good reason marijuana is illegal.
Legalization of medical marijuana is one step closer to becoming a reality in North Carolina. Just within the hour, senators in Raleigh passed a bill.
As many as 88% of Americans support the use of marijuana in the United States of America, yet marijuana continues to be classified as a Schedule I drug under the federal government. The federal government acknowledges little to no medical benefit in marijuana usage. Despite federal disapproval, as many as 24 states have already legalized marijuana for medical use, while many more are still debating it, such as our own state, North Carolina. About 3.8 million people in the United States are prescribed medical marijuana as of 2022, according to the Marijuana Policy Project. Chronic pain is characterized by its long-lasting effects and symptoms way past the initial injury that was sustained. Many patients in the United States are prescribed medical marijuana as a treatment for chronic pain by medical professionals, yet the federal government refuses to acknowledge its benefits on a federal scale. 51.6 million people suffer with chronic pain in the United States, and of those 51.6 million, many do not have access to medical marijuana and are instead prescribed highly addictive opioids. An observational study conducted at the University of the Sciences in Philadelphia set out to find the relationship between health-related quality of life and medical marijuana usage for chronic pain in patients enrolled in their medical marijuana program. 181 patients ranging from 18 years or older with an average age of 41 years completed a series of 4 surveys to chart their overall health quality in using medical marijuana to relieve their chronic pain. The measurement used to analyze the quality of life was the Euro-QoL 5-dimension survey. A final score between 0 to 1 is measured, with a 0 value corresponding to death and the 1 value corresponding to a healthy life. The 5 dimensions of the survey include mobility, self-care, usual activities, pain, discomfort, and anxiety, depression. Overall, the survey shows the generic quality of life of people in Europe and in many other places in the world who share similar values, such as the general population of the United States. According to the study, a positive relationship between medical marijuana usage and health-related quality of life in patients using it for management of chronic pain were shown. This study overall shows that medical marijuana can have a positive effect for people in managing their chronic pain, as the subsection for pain/discomfort showed significant improvement. This shows that marijuana is not a dangerous drug with only negative effects, but instead an important treatment method that can increase overall quality of life to its users. Critiques of the study would include the use of a European-centric survey in a country with a large diverse set of people coming from many countries of different values. This could skew some results, as many people have different ideas and values that may not align with what the survey deems as healthy and not healthy. It is also important to note that only 181 people out of a total of 1,393 people who met screening standards were able to fully complete the study and have their results analyzed. This small yield in people should be increased in further studies to have a more supporting analyzation in the relationship between medical marijuana and treatment for chronic pain. The study as well mentions a decline in self-care, determined on the Euro-QoL 5-dimension survey as the highest value being "I have no problem with self-care" to a lower value being "I am unable to wash or dress myself." This decline could be due to differing side effects in medical marijuana usage. The study recommends the need for more research on this subcategory. And knowing this, it is important to acknowledge that although medical marijuana is primarily used for treatment in pain for many people and is shown to have a positive relationship in managing that pain according to the study, it is still a drug that can impair one's ability of thought and reason. An observational study done in Washington state notes that of the people who use medical marijuana for chronic pain, 50.7% use applied products for consumption, medical marijuana. More research on the long-term effects of applied use of medical marijuana must be done to see how it can truly affect a person's quality of life and overall health outcomes. What comes next? Well, in learning about how medical marijuana can have a positive effect on quality of life and managing chronic pain, we can destigmatize the use of marijuana as a dangerous Schedule I drug under the federal government and instead start seeing it as a valuable healthcare resource. We can help reduce millions of people's chronic pain by allowing the usage of medical marijuana in our country on the federal level. In the future, more research could be done to further advance our knowledge on marijuana and possibly help us to understand additional methods in using marijuana to cure chronic pain illnesses. Studies with higher patient yields could be done to see if there's a stronger valid relationship between medical marijuana usage. Overall, more studies can be done to look at medical marijuana beyond just its ability to manage pain. Currently, though, for many people suffering with chronic pain in America, any possible negatives for long-term marijuana usage far outweighs any undiscovered long-term effects.